eConsult is a referral system where I have the means as a family physician to consult specialists without the patient actually having to go see the specialist. I might use it for a patient who I'm planning on referring anyway, needs to be seen, but I just want to make sure I'm on the right track. Is there anything I could be doing in advance of the consult to help? Anything I should be ordering or arranging to get that advice?
You can take a picture with your phone if there's a rash, if there's a lab result that you want to attach to it, you can do that as well. You bring that then to the computer. You log in very simply using a username and password, and it takes you to a main screen that allows you to choose what you want to do. That screen also has a list of all the consultants that are a part of this, so you can quickly review through who you think they should go to.
I get an email, maybe there's a pending eConsult for me, and I have 7 days to answer it. The patient's identifiers are there, so I can look up any blood work, any investigations that they've had so far, and a short note from the GP. I can respond to that. I can send back any literature or scan things, PDFs.
With eConsults, I get a report back, and I can download it as a PDF. So then I'm able to scan that to the patient's chart and have it as a formal consult for that patient, because it is attached to a patient's name and date of birth. So it can go in my EMR and I can have that record.
There's times when I need a quick opinion, and before I would have to pick up the phone and call somebody. If that surgeon happened to be in the operating room, or if that doctor tended to be on round or in clinic, you really feel bad about taking their time.
From the specialist standpoint, there's always been that issue of the quarter consult and no documentation of it. And this changes that. We can always go back and see what we've been told, the date we've been told it, and what our response to that eConsult was.
I work in a very rural practice, and I have a lot of seniors here. So if I have somebody who has a condition that I'm not quite certain about, I can do it quickly with this. It saves them having to drive 2.5 hours to St. John's. It saves them the months of worry, waiting, wondering what the heck is wrong with me.
Here in Corner Brook, there are certain specialties we just don't have, and some specialists we do have, we only have one or maybe two. So those specialties have long wait lists, where the patient might be waiting a year or more to see our local neurologist.
If you imagine yourself as somebody who's at home and feeling very sick, and your doctor tells you, well, it's going to be 2 years before I can get you into that specialist, that's very disturbing. Even if it's something that the medical system might not consider to be urgent, for each patient, their own problems are the utmost urgency.
Our wait time now is about 7 months for a routine referral to orthopedics, so if we could lower that by taking out some patients that really truly don't need a referral. And on the other hand, identifying patients that need the urgent referral. I've done that too. I'll see this patient Tuesday in clinic, as quick as that.
It also increases the relationship between the family doctor and the specialist, and that they get this open conversation back and forth. They're able to teach the family doctors, okay, maybe this doesn't need to be seen right away, or maybe this is something that you could manage on your own.
The vast majority are actually quite short and simple questions. At least 90% don't result in a referral to the specialist. And when it is, I would say, yes, I need to see this patient. Referral is required. But before they come, get an MRI, gets them to get this done. So it makes that first visit with me much more effective, avoids second trips back for patients that need specialized testing.
Usually the turnaround time is a week. So I can get really quick advice on something. Otherwise the patient might be forced to travel to St. John's or elsewhere, which is really, costly, stressful for patients. And they might be going all that way for, like a half-hour appointment.
It doesn't take much time to do the eConsults. The vast majority of them can be done on the fly, lunchtime, at the end of the day. I think on a day-to-day basis it may be adding this light bit of work, but in the long term I think it's going to pay dividends where it's going to unload our work and make our work more rewarding. We're seeing the patients that we need to see in clinic.
This is a program that's been tried and true in other provinces, and we have come in as an early adopter as well. I think it's showing a progress. We all know that technology is a part of our present and our future, and this is a way that we can use technology to our advantage to provide better care for our patients and the people of Newfoundland and Labrador.